Hello, this is Leslie Wommeldorf. I'm a faculty member with the College of Nursing at the Hershey campus, and we look forward to meeting all of you as we begin the IPE Faculty Development Program at the Hershey Medical Center later this week. The learner outcomes for this presentation related to adult education is that by the end of the module, we hope that you will be able to describe the concept of adult education and what both learning and teaching mean to learners who engage in adult education activities. We also think this presentation will help provide you with an opportunity to examine your beliefs and develop an individual philosophy of education statement. Also, applying adult learning principles to the development of your IPE project, and that you'll be able to describe several adult learning theories that are applicable to the IPE context. To be effective, faculty development programs must be designed on educational principles aimed at maximizing learning for adults. Common characteristics of adult learners include that they are active in their learning. Students in elementary through undergraduate education frequently encounter passive learning environments. However, as adults, learning should be student-centered and engaging. Often with education, due to curricular demands, learning is directed by the educator. Creating opportunities for self-directed learning afford leadership and direction to the to be student-focused. For example, creating your IPE, IPP projects is very much self-directed. Experts are available to assist and answer your questions, but you are in the driver's seat. As part of the affective domain, adults demonstrate a readiness to learn and participate. Internally motivated and goal-oriented. In formal education settings, grades are often a driving motivational force. Although work and supervisors may be a motivating force for adults, adult learners usually have a goal in mind and/or are internally motivated, such as a desire to be a better educator, a health professional, etc. As Malcolm Knowles emphasizes, adults have a rich and vast experience base as compared to children. Adults have a broad knowledge base that is built upon past educational, life, and work experiences. Adult learners expect education to be meaningful and applicable to what they do or want to do. For example, this IPE faculty development program is designed to provide real-life examples that can be applied to various clinical learning settings. Along the lines of internal motivation, adult learners generally expect education to help them reach a greater competence level and potential in their field of interest. The next few slides will go into more detail of each of these characteristics or conditions of adult learning. To earn a learner's trust, we must provide appropriate transparency and provide all the information he or she will need to succeed. If the learner doesn't have all the needed information, it causes a delay and may undermine the learner's self-confidence and create a barrier between the educator and learner. Create opportunities that encourage learners to share views. We each bring to the table strengths and weaknesses. By providing time for discourse, we acknowledge the value each learner has. Being open, honest, providing all the information, and encouraging of diverse views. As educators, we create a safe, supportive learning environment for professionals to model and grow. This image of the trust fall makes me think of this, especially as educators and learners, we have to trust each other. And same thing with IPE. We trust the other team members with their roles and responsibilities, and we work together for that patient-centered care. As part of making use of learners' past experiences, educators demonstrate the value of past knowledge and skills. Linking new learning to previous knowledge and experience is similar to building a pyramid. Ensuring a strong foundation supports the advancing structure. To support that advancing structure, educators should explain why and how and reaffirm knowledge and skills. Learners need to understand the scientific basis behind a practice to adapt those principles to different situations. Lastly, it's important to have an organized teaching plan. Objectives can guide your teaching plan. Ensure learning is in a sequenced, logical fashion. For example, if we were teaching safe use of tourniquets in an orthopedic orientation course, we would explain why tourniquets are used based on scientific research and how to apply its use and document its use. Educators might also review policies and procedures commonly encountered in the orthopedics unit and point to how tourniquets fit in with the other care components. The concept of scaffolding involves learning small portions of information and then building upon them. As the learner becomes efficient and competent with foundational skills and knowledge, the educators can then layer on more advanced information. Repetition is a valuable tool. For example, as learners gain confidence and competence by repeating procedures, the educator can then facilitate learners to apply those skills and tools to different patient scenarios and situations. As educators, we need to allow learners to make as many choices as possible during the learning experience. This encourages that self-direction and exploration and can promote them to become self-sufficient. Learning is mentally and physically exhausting. When able, encourage free time as a reward for hard work and good performance. During this downtime, engage learners in simple, stress-free learning tasks, such as stocking blanket and fluid warmers, or other appropriate tasks for unassigned times. Completing even small tasks can provide a sense of accomplishment. We also need to make sure that the learners know what resources are available. Take the mystery out of procedures. This demonstrates transparency and clear expectations. Resources could be hospital policy manuals, commonly referenced journals, and medication databases. Adult learners need to know why are they learning specific content and skills. Provide cases or scenarios that demonstrate the content's value. Then apply learning to other contexts to broaden the learner's perspective of its importance and application to other situations. Asking the learner to share their experiences, ideas, and input will promote their partnership in learning and provide positive reinforcement for their engagement in the learning process. Feedback and evaluation can be extremely challenging. Considering what the educator has identified as learning objectives or outcomes can provide insight into how one should evaluate learning. Learners should be a partner in the evaluative process. Encourage self-reflection and evaluation. Naturally, there will be a power imbalance between the educator and learner. However, clearly developing expectations together will encourage the learner's ownership in the learning process. At times, educators might encounter a learner that they believe will not be successful or adequate as a health professional. Ideally, that determination should be made very early on. We need to work with learners to develop remediation plans, identify learning resources and learning needs, and other potential professional opportunities. We're going to shift gears now to examine more deeply who you are as an educator. Are there specific words you would use to describe yourself as an educator? This module provides you with the opportunity to take some time to examine your beliefs about teaching and learning. Here are some questions I invite you to reflect upon and write responses to. When you're done writing your responses, move to the next slide and prepare to complete a teaching perspectives inventory. You can complete the inventory more than once, and I encourage you to complete it every couple of years as you develop as an educator. Our values evolve as we grow and develop professionally. So for this activity, you're going to complete the Teaching Perspectives Inventory by Pratt and Collins. Reflect on your TPI results, and then write an educational philosophy statement with your role as an IPE educator in mind. And this can be 1 to 2 pages in length approximately. Submit your philosophy statement to the Canvas Dropbox located in this module's folder. These philosophy statements are private and will not be shared with other learners in the program. Before moving forward in this module, please pause this PowerPoint and audio in order to complete your philosophy activities. We're now moving from a personal philosophical stance to learning theories that can assist educators in the development, implementation, and evaluation of learning activities, specifically for IPE. Learning theory describes how knowledge is absorbed, processed, and retained during the learning. Theories are extremely helpful to educators in that they guide educators' decisions about curriculum, class, and clinical learning. They encourage focus and direction. They provide us, supply us with experiences and tools, and they can help educators determine the best evaluative strategies. There are many learning theories. As an educator, one determines the theory that aligns and is foundational to the learning activity. It does not have to be just one theory either, but possibly other theoretical perspectives supporting the learning strategy. For example, an educator plans a simulation activity that incorporates psychomotor skills and teamwork. The educator may choose a more behavioristic focused theory, as well as collaborative learning theory. The next few slides highlight just a few of the commonly encountered theories in the IPE literature. Please keep in mind, there are multiple theories that support IPE. It will be up to you as the educator to determine the theoretical framework that best fits your learning strategies or your IPE projects. Bandura's social learning theory posits that people learn from one another through observation, imitation, and modeling. The theory is often considered a link between behaviorist and cognitive learning theories because it encompasses attention, memory, and motivation. Much of the learning occurs in the social environment. People learn from observing others through rules, skills, beliefs, and attitudes. Key elements of this theory include motivation, modeling of behavior, and the environment. The short video example of social learning theory provides an exaggerated example of how learning takes place. Trying to find video clips that keep us awake and don't put us to sleep related to learning theory was one of my objectives. So I hope this clip is entertaining to you, and it is not meant to be offensive or make light of poor role modeling and learning. Click on the picture to access a brief video clip. And if the clip doesn't run, based on this MP4 file, I will also include the PowerPoint so you can access it through that link. Critical learning theory looks at the ways in which ideology shapes education as a way of maintaining existing privilege and social control. Critical learning strives to acknowledge that there is an influence of the status quo. Educators and learners explore how instructors, power, oppression, social class, capitalism, culture, gender, etc., influence learning. There's 7 tasks typically involved with critical learning theory: challenging ideology, unmasking power, learning liberation, practicing democracy. Testing Hegemony, Overcoming Alienation and Reclaiming Reason. Have you encountered hierarchy-related issues in the workplace? This serves an example where critical theory could help explain or address such power or marginalizing issues. Experiential learning is learning by experience or by doing through formal or informal IPE opportunities. Leaders in the field of adult education speak to the value of experience as essential to the learning process. Knowles emphasizes that adults come into an educational activity with both a greater volume and a different quality of experience from youths. Lindemann, another early adult educator, is famously quoted for saying, "The whole of life is learning," as well as the resource of highest value in adult education is the learner's experience. Through this theory and adult learning, there's a reservoir of past experiences that lend to future learning. A significant component of experiential learning is reflection. Students make meaning while participating, engaging, and observing in the moment of the experience. Healthcare learners and professionals frequently adapt as they go, adjusting the course of care to meet the patient and or family responses to treatment. This is an example of reflection in action. Reflection may also occur after the experience, and that's termed reflection on action. By both critically reflecting, health profession learners can transfer their experiences to future care of patients and families, as well as future interactions with multiple disciplines. There are two forms of experiential learning theory. Situated learning theory involves learning that takes place through the interaction. Situated learning emphasizes knowing results from the situational context, and that the knowing and situation are inseparable. This theory acknowledges the context and social determinants of the learning experience. Communities of practice builds upon situated learning, but it also occurs as people interact through learning communities. Wanger stated that belonging to such a community involves a learning process, a form of collective meaning making, of interpreting, acting, and reflecting on action. Meanings are negotiated through participation in the community. Again, there's another short video clip here, not quite as entertaining as social learning theory, but please feel free to pause and access this brief video on experiential learning. Narrative learning theory supports how learners define their experiences within the context of narratives, which serve as cognitive structures and as a means of communication, as well as aiding people in framing and understanding their perceptions of the world. Meaning making occurs through narration. Stories with an individual learner perspective. Narrative is also how we craft our sense of self, our identity. Narrative learning, in contrast with other theoretical orientation, attempts to describe development from the inside as it's experienced rather than from the outside as it's observed. The learner is not only connected to his or her narrative, but more importantly, is connected to how that learner lives his or her life in relation to that narrative. Through a grounding of theory, adult learning educators can supply experiences and tools for learners to apply their knowledge, better function together, and improve healthcare. When examining theoretical frameworks appropriate for IPE context, one could consider a micro-level or a macro-level view. A micro-level view centers on an individual's learning view. However, aligning with the definition of professional expectations of interprofessionalism, I strongly gravitate toward a macro-level theory. Macro-level refers to a learning emphasis on the community of learners, or a system of learners' interdependence in the learning process. So recall the definition of IPE, an activity where two or more learners learn from, about, and with each other to enable that effective collaboration and improve health outcomes. So through the link of adult ed and IPE, we want to leverage those IPE teams, the interactions, the knowledge, and the experiences of everyone involved in the team. There's an encouragement of dialogue and problem solving through case studies, problem-based learning, team-based learning, simulation, group discussions. Here we value the relationships of learners and through the concept of sociocultural context and the environment. These have a greater impact on the learning. We also, as educators, want to encourage reflection through a variety of methods, personal and interprofessional team perspectives. We also acknowledge philosophical beliefs and incorporate strategies that align with ourselves and the learner's needs. The Interprofessional Education Collaborative is a nationally recognized organization that provides and supports initiatives that develop IPE for healthcare students. IPEC reiterates that providers and learners need to work with individuals of other professions to maintain a climate of mutual respect and shared values by embracing the cultural diversity and individual differences that characterize patients, populations, and the healthcare team.